Hi everyone, welcome back to my channel. So I just first of all wanted to say thank you for all the support on the last video. I've read through all the comments and really appreciate all the kind messages, so thank you for that. And today I wanted to do a little update again, kind of linking in with the last video. So if you've not watched that already, I would probably suggest watching that first. Just might make a bit more sense because from this video alone it might not make complete sense. So yeah, the last few weeks have been pretty rough, to be honest, pretty horrendous. Obviously if you've watched the last video you'll kind of know what happened and what went before that. So it's been a lot of, vet trips and getting investigations done, trying to work out what's happening. So trying to think of the last video. So from the last video you'll probably have known that we lost Isla, and then on the following Tuesday, which was the 7th of December, we lost Sofia. And I kind of at first just put that down to probably stress from the operation. We couldn't really get her eating again, to be honest. She was on syringe food, but it was a real struggle to get her to eat anything. Even with the syringe feeding, it was a real challenge because she absolutely did not want that. So we tried and tried, kept trying to syringe feed her, but ultimately she did pass despite us trying our best to get her eating again. But at first I kind of just put it down to the operation, and maybe it was the stress of that, because that seemed the most logical thing at the time. Until it was the following weekend, so Saturday the 11th. In the morning I'd found Florence, and she was looking the exact same way Isla was when she was poorly. And bear in mind, from finding Isla being poorly to her passing, there was a very short window of time. We're talking less than 24 hours really, so this, whatever it was very, very rapid. I was obviously starting to get a bit concerned because it was kind of mimicking what had happened with Isla. And very sadly, Florence also passed away that same night. Bear in mind, this was very rapid. From me finding her to a passing, there was probably about maybe 7 to 8 hours from when I found her to when she passed, so this was very, very rapid. And the day prior to that she was absolutely fine, eating as normal, acting as normal, absolutely nothing to see, which was the most shocking part about all this. And again, it was the same with Isla, so really horrible. And the following morning we also found Betty. Bear in mind, again, I hadn't noticed anything wrong with Betty, and I found her in the morning. She was in the hutch lying behind one of the trays, and yeah, she was completely gone. So at this point we're thinking, okay, this is really serious. This is clearly some kind of virus or infection which is going through all of them, and we have such basically a short time between when they're showing symptoms to when they're passing, and Betty actually didn't show any symptoms. I just found her the following morning, so obviously this was a real shock. Basically I rang the emergency vets on the Sunday and said, look, got this situation with our guinea pigs, I really don't know what to do. So they had suggested taking the 2 guinea pigs for post-mortem, which is obviously the logical thing to do. So on the Monday we had drove up to Aberdeen to have them taken to a lab for post-mortem, which we really needed doing because there were no other way we were going to find out what's going on. So obviously this took a few days. It wasn't an immediate answer. I think they did it as soon as they could, but it wasn't like next day. It was a couple of days before we even got any information back. So by this point I'm obviously really freaking out because I'm just thinking I'm going to lose them all and I don't know what to do. At this point in time we didn't have any diagnosis, so it's just a waiting game really, and it was honestly the most horrible, well, however long this had been going on for, it was literally the worst, especially not knowing what was happening and not being able to do anything for the others. And we'd been taking out the sick ones as soon as we could to try and eliminate them from the others. Okay, so quite a few days later we did get some results back from the lab. One of the guinea pigs had passed due to septicemia, that was Betty. This infection, which they'd found, had entered the mouth, gone to the lymph nodes and resulted in septicemia. Yeah, and they said the bacteria which they'd found is something that guinea pigs can naturally carry without it affecting them, but in this instance there is a bacterial infection, and I will get to what we think the cause is after I've obviously been through all the others, because it will kind of collectively make sense at the end. And then with Florence, they'd said the cause of death with her was due to pneumonia. So 2 different causes of death, but essentially it's from the same bacteria. Okay, so we were fine for a few days. The others seemed pretty healthy. Overall they were doing okay, and we hadn't had any more pass until the Friday. And on the Friday I found Penny in the morning, and she was fine the night before. I checked them all the night before, they're all fine. And yeah, she'd literally gone by then. So I was in contact with the vets quite a lot and just trying to keep in touch with what was going on. And basically as soon as they'd got more info from the lab, they were able to give us some antibiotics. So after Penny passed, I was quick to go get the antibiotics, and they're also on an anti-inflammatory as well, because they say this is quite effective against this bacteria, so it's the best thing for them to be on right now. So they're getting antibiotics twice a day to try and basically kill this infection, and just giving it to all the guinea pigs in case they are infected without us knowing. So yeah, we started them all on the antibiotics then. So all the rest again seemed pretty okay, and I kind of assumed that we were going to be alright. They're on the antibiotics. Hopefully we've got a chance of saving the others. And then unfortunately Lola did pass away. Again, it was very sudden. She was fine one night, and the next morning I found her looking, very, very poorly, and she'd gone within a couple of hours after I found her. And then the following day, which was in fact just yesterday, we'd lost Evie. So obviously this is a lot to take in. It has been a horrible, horrible few weeks to have lost so many guinea pigs so close together, and they'd never had any health problems before, no prior health problems, so it's obviously been a massive shock. I actually think even Sofia's inflamed eye could have been linked to this. It was taking off the young ones and the middle-aged ones, the more elderly ones, so yeah, this infection does not discriminate. So the bacteria they said it was is a streptococcus, which is, again, like I say, something which guinea pigs can carry normally. And having wrote out like a timeline of everything which happened, we think we can trace it back to Mabel. So yeah, we are down to 3 now, which is insane. To have gone from having so many to 3 in such a short space of time, it's quite hard to get my head around. And yeah, I think the reason that we still have Mabel, who, bear in mind, was probably quite suppressed anyway. She had had a really bad ear infection and all that. So if any of them were... So I thought if any of them were going to get sick, I thought it would be her, because she'd already had that quite bad infection. So I think what I can trace it back down to is when Mabel had an ear infection, and so the ear infection had cleared up, and she had this big abscess on her head, which again is quite an unusual thing with guinea pigs. So we think that the ear infection had got quite deep into her ear and came out as this big abscess on her head. So we'd taken her to the vets, as I said, got that cleaned up, got antibiotics. And bear in mind, this abscess had ruptured, so there was pus coming out of it. The other guinea pigs were in contact potentially with this infected wound, which has the bacteria which has kind of caused this infection. So I think that is what the most likely cause of this is. I could never have foreseen this happening. We weren't even told to isolate from the others when we'd taken her to have her abscess cleaned. As far as they were aware, it was just fine to put her back in. So obviously, yeah, I think what happened is maybe one of the guinea pigs had come into contact with the abscess, and bear in mind that could have had a huge amount of this infection in it, and it would probably only take like an abrasion on one of the guinea pigs' mouths to come into contact with this infection, and then, you know, that enters the body and it spreads, and then she's no longer the only host of this infection and it can spread through them all. This is been a really hard video to make actually, and like I say, yeah, I think Mabel is one of the ones who didn't get sick because she'd maybe been gradually exposed to this infection, whereas the others had just come into contact with a lot of this bacterial infection. At least that's what makes most sense to me, given the timings and everything. It all just fits. And yeah, the first guinea pig to get sick was literally just after the abscess had ruptured. So it just makes sense she could have come into contact with that. And then it can just spread through direct contact, I think. So yeah, we have Mabel, we have Angus, who is our neutered male, and we have Pandora. So only 3 left now. Yeah, it's really strange, to be honest. They are still on the antibiotics. They're going to be on the antibiotics for 2 weeks, just in case they have this infection inside of them. And yeah, just kind of as preventative really. They may not have been infected with it, but we're just giving it just to be on the safe side, because I'm not taking any chances and I just want to give them the best chance really with the ones I've got left. So yeah, we'll see how they go anyway. I just wanted to do this video to keep you all in the loop, and obviously I'm not wanting to just carry on as though nothing has happened. So yeah, I'm sorry if this puts a bit of a downer on things. Obviously, you know, this time of year should be kind of happy and, you know, not a time to get down in the dumps about things. But this is real life and this is happening, and I don't want to just carry on as though it's not happened. Obviously I share so much of, you know, the animals' lives on the internet that it only seems right to share this as well. As for Mabel and her infection in the abscess, it's all completely cleared up now, so there isn't any of that left on her. She's also on the antibiotics, so we should be treating it from the inside as well. So yeah, that was a lot to get into one video. Yeah, I don't really know where to go from here, to be honest. The guinea pigs I brought into this outside room just because there's only 3 of them now, and I figured it would be warmer for them. It is a bit more sheltered in here, and I just felt it was the right thing to do because it doesn't seem right to have 3 in a huge stable and a huge hutch up there. So I've moved them in for now, and I think it's just going to be better having them in here. I can keep an eye on them much better. I can give them the medication a lot easier, and I just generally am much happier with them being next to the house with there only being 3 of them. So yeah, we're also trying to make sure they get plenty of probiotic because they are on quite a large amount of antibiotic, which kills off the bad bacteria, which is how it's going to help, but it's also going to kill off like good gut bacteria, which can really affect guinea pigs because they have very sensitive like gut flora. So we're trying to also make sure they're getting plenty of probiotics, and yeah, it also contains like extra vitamin C, so it's going to generally hopefully support the immune system. So we really have done everything we can for them. Like honestly, we've tried to act as fast as we could, get the postmortem and try and give them the medication as soon as we could. So I'm just kind of taking it each day as it comes at the minute, to be honest, because that's all you can do. But yeah, I think that's all I have to say for now. Again, thanks if you've watched this the whole way through. This has been like 21 minutes long I've been talking for, so probably time to finish speaking. Yeah, as always, thanks for the support, and yeah, I'm not sure what my next video will be. I'm hoping I will soon be able to make some more positive videos and just generally get back to normal with things, but it's not been easy. But yeah, once again, thank you for watching, and I will catch up with you guys soon.